Welcome to the Prostate Health channel. If you're new here, thank you for joining us. This is a space dedicated to sharing reliable, clear, and science-based information to help men better understand their health, especially when it comes to the prostate. The numbers are quite serious. In the United States, it is estimated that around 315,000 men will be diagnosed with prostate cancer this year alone. Many men hear myths or partial truths and either panic unnecessarily or delay seeking proper evaluation. While it is true that age is a significant risk, in fact most cases are diagnosed in men over the age of 65. This doesn't mean younger men are completely safe. That's why in today's video, we're going to break down the prostate is shaped somewhat like a donut, with the urethra passing through the center. The PSA test, while useful, isn't specific to cancer. This score is based on how the cancer cells look under the microscope and ranges from 6 to 10. Gleason score of 6 indicates a slow-growing, less aggressive form of cancer. In the past, this concern was valid, but today, thanks to significant medical advances, the situation has changed dramatically. The two most common concerns among men are urinary incontinence and erectile dysfunction. While some men do experience these issues after treatment, recovery is very possible, and many regain control and function over time. Recovery depends on several factors, including the man's age, the stage of the cancer, the technique used during surgery, and overall health, whether you're considering screening, already have a diagnosis, or are helping a loved one through their journey. Staying informed is the most powerful step you can take. That way, you'll never miss important updates on prostate health and other essential topics for men. Your support helps us continue spreading awareness and encouraging men everywhere to take charge of their health. Many men do very well with proper post-surgical care and support. Surgical options like robotic-assisted radical prostatectomy are now much more precise. Older radiation techniques used to carry a higher risk of damaging nearby organs like the bladder and rectum. But now, with advances in imaging and targeting technology, radiation can be delivered much more accurately. Tools like fiducial markers and spacers help protect surrounding tissues by ensuring that the radiation is focused exactly where it is needed. This has greatly reduced the risk of unwanted side effects. This minimally invasive method allows surgeons to remove the prostate and surrounding tissues through small incisions, using robotic instruments for enhanced control and accuracy. These focal therapies aim to treat only the cancerous area within the prostate, rather than removing or irradiating the entire gland. While promising, these methods are not suitable for everyone and are typically offered to a small group of men whose cancer is in a very specific location and stage. In many cases, these low-risk cancers can be safely monitored through a strategy called active surveillance, meaning no immediate treatment is needed, but regular follow-up is essential. This approach helps avoid overtreatment while still keeping a close eye on the cancer. PSA levels can rise due to BPH, prostate infections, or even recent sexual activity or cycling. When deciding on treatment, doctors consider many factors: the patient's age, general health, expected lifespan, and personal preferences. For men with more aggressive or advanced disease, timely treatment can make a significant difference in outcomes. It's just a signal that something may need to be looked at more closely. In recent years, we've seen major improvements in how prostate cancer is diagnosed. Multiparametric MRI scans can now give us detailed images of the prostate, allowing us to identify suspicious areas with much more accuracy before deciding if a biopsy is needed. Most prostate cancers begin in the outer regions of the prostate away from the urethra. Because of that, these cancers don't affect urination until they grow significantly. That's why regular screening is so important. A PSA blood test, which measures prostate-specific antigen levels, is a valuable tool for catching potential problems early, even before symptoms appear, and clarify some of the most common misunderstandings about this condition, so you can take better control of your health. Sadly, about 30,000 men are expected to die from the disease. In Australia, those numbers are roughly 20,000 new cases and 3,000 deaths per year. These statistics are a reminder of how essential awareness, prevention, and early detection truly are. Let us begin with a very real concern. Prostate cancer is currently the most commonly diagnosed solid cancer in men. Aside from skin cancers, unfortunately, there's still a lot of misinformation surrounding prostate cancer. One widespread belief is that prostate cancer is only a concern for older men. Another common misconception is that prostate cancer always causes noticeable symptoms. Many men expect that if something is wrong, they'll feel it. However, prostate cancer often develops silently. Men may begin to experience urinary changes like weaker stream, increased frequency, or urgency and assume these symptoms are due to cancer. But more often, these issues are related to benign prostatic hyperplasia, or BPH, which is a non-cancerous enlargement of the prostate that tends to happen naturally with age. The reason prostate cancer usually doesn't cause symptoms early on is anatomical. However, a raised PSA level doesn't automatically mean someone has cancer. That brings us to another misunderstanding. Once a biopsy is done, and if cancer is confirmed, we use a grading system called the Gleason score to understand how aggressive the cancer might be. But not all prostate cancers are. Some are aggressive, with higher Gleason scores, and do require active treatment. Now let us talk about a fear that stops many men from even getting screened. The idea that all prostate cancer treatments lead to severe side effects. Naturally, any surgery comes with potential side effects. Aside from surgery, radiotherapy is another highly effective treatment. There are also new, less invasive options being researched and used in select cases. Ultimately, the key message is this: early detection saves lives, and modern treatments have come a long way in improving quality of life. If you found this video helpful or informative, please take a moment to like it, share it with someone who might benefit, and subscribe to our channel. Thanks again for watching, and we'll see you in the next video.